A lot of times people will see those birth pauses and they call it a stall. Even women will say, and then I was in labor and I stalled out, so they had to start Pitocin. Your next section is posterior babies. So you have a few handouts on why the C-section rate in the United States is so high. And one of the reasons is we see that on the C-section reports, the surgery reports, they always have to write a reason why the C-section is done. And the most common thing we see is what's called failure to progress. And Ivy and I like to call it failure to be patient. A lot of midwives and doulas call it failure to be patient. So, you know, we talked about the birth pauses earlier and how common it is for women to have birth pauses. And a lot of times people will see those birth pauses and they call it a stall. Even women will say, and then I was in labor and I stalled out, so they had to start Pitocin. I always say, no, you didn't stall, don't call it a stall. You had a birth pause. It's a very normal physiological thing that happens in almost every labor, where a woman will have a birth pause. Now, sometimes you can have a baby in a malposition, and that malposition will cause the body to slow down, contractions to slow down. Maybe the mom will feel pain in different areas than she did before. And that kind of pause, we can help those kind of pauses. If those pauses are due to what we call a malposition, we can do things to help with that. And there are some signs that you can see to tell whether a baby is in a malposition or not. There's a growing body of midwives and doulas who see posterior babies, which we would often call a malposition, as just a normal variation of labor. And many women do have posterior babies. Whoa! Gotta hold that leg intact. Many women do have posterior babies, and a lot of times those babies will rotate or they'll come out posterior. No big deal. No big deal. But many women will have a posterior baby that is what we call a persistent posterior. Has anyone had a posterior baby in here?
Yes. So
there you go. Was that your second?
Both of them.
Both of them, yeah. And your labors ended up being quite long.
Yes.
Yeah, you had a posterior baby. And you had a posterior baby. What was the number one thing that happened that is just seared in your brain about a posterior baby?
Back pain?
Yeah, back pain. Back pain.
Pushing forever.
Yeah. What did you say?
I pushed forever. And
Yeah.
then he had to be vacuum assisted.
Yeah. So back pain. That is always what you hear, number one. The number one complaint you hear of women who have a posterior baby in labor. So if we can give women the opportunity to move and rotate and utilize tons of positions, almost always posterior babies will turn, they'll come out, or they'll come out posterior, and everything's great and we got through the labor, even though it was somewhat challenging, right? But a lot of times, because it does take longer for often, not always, for posterior babies to come out or for posterior babies to rotate to an anterior position, it can take a lot longer and cause more pain for the mom, which often will lead her to a point where she's so tired that she can't really utilize positions anymore. And so oftentimes we see people end up in C-sections because of that. So I'm going to teach you the things that you can do to facilitate the birth of a posterior baby. So all these things I'm going to teach you are either things that will help the baby rotate to an anterior position, which will be a little bit easier for the baby to come out, or it will help open the pelvis enough that the posterior baby will come out posterior. And I've seen babies come out posterior. You've been with me on some posterior birth.
First time on Easter last year.
Yeah. Yep. And the baby just came out, right? We worked on it.
And
We
it
had
took 4 hours.
She pushed for 4 hours, but she got that posterior baby out.
And it was her first baby too, so it was really
Yeah.
incredible to watch.
Yeah, really incredible. Okay, so posterior means that the baby is what you hear sunny side up sometimes. So the baby's face is facing outward. The baby's body is facing outward. This is how the pelvis is in the mom, except for it's bent a little bit more like that. And so posterior means that the baby is turned like this. So the back of the baby's head is toward the mom's spine. Okay? Anterior, which is what most babies are in an anterior position, is like this. So the baby is at the front of the pelvis, anywhere around here. This is all called an anterior position. So on anterior, moms who have a baby in an anterior position, you'll see a nice round belly usually. With moms who have a baby in a posterior position, sometimes you'll see the belly button sunken in a little bit. Have you guys seen that before? Did that happen to you?
Mm-hmm.
Yeah, where there's just not a lot pushing out. And where you've had 2 posterior babies and you've had 2 posterior, how many?
Just one.
1 posterior, okay. For someone who's had, like several babies, but maybe one of them was posterior, we see that happen. And sometimes it's a cord issue, sometimes it can be related to the baby's anatomy or something like that. But if we have a mom who has posterior babies every single time, sometimes that's just the way, it's just your anatomy. It's normal for you, but it's helpful if you have the support to know how to get a posterior baby out.
Are there any other signs?
Yes, there are so many other signs. What are some of the signs that you guys know of?
It's not kind of a word, but I guess back pain.
Yeah, back pain is probably the number one. Although about a third of women will have back pain, and not all of those babies are posterior. But it's something you can go,
Yeah.
this mom's having a lot of back pain. I wonder if this baby's in a posterior position. So it's something to ask yourself.
So that's before contractions, before labor, they're having back pain, like
No, during labor.
during labor.
But some women also have it in pregnancy too.
Okay.
They will have back pain in pregnancy. Let's talk more about the signs of a posterior baby. So a lot of times the labor will be somewhat sporadic. So we won't have like a really definitive labor pattern. And that's a really big sign of a baby in a malposition. In a posterior position, sometimes it can mean that the baby's very cord wrapped. So kind of a labor that's just like not quite having a definitive pattern. So maybe we'll see contractions 7 minutes apart and 30 seconds long, and then 5 minutes apart and 60 seconds long, and then 4 minutes apart and 45 seconds long. So it's just kind of all over the place. Sometimes we can see double peaking contractions. That's another sign. A lot of times women, labor will be long. So it'll be long and dragged out. And it's very common to see these labor pauses or plateaus like we talked about earlier. Plateaus in labor are very, very normal. A lot of times we'll see someone get to like 6 centimeters and then she won't she'll just kind of stay at 6 centimeters.
Is the body waiting for the baby to
A lot of times the mom will not resume dilation until the baby rotates.
Yeah.
So
That's what happened for me.
is that what happened to you?
Yeah, so my son, I guess, he couldn't figure out how to get his head in right, so he was posterior, and I guess he couldn't get into my pelvis.
Yeah, so let me
He
show
was
you
like-
what posterior babies do. So
Yeah.
for a posterior baby, an anterior baby is well flexed. So everyone go like this with your heads. Put your chin on your chest. That's what most babies do when they're coming through. So touch the top of your head right here. See, you feel how this is the smallest diameter right here? But then when you deflex your head, you lift your head up, what happens? That diameter goes much bigger, right? Yeah, so what posterior babies do, in order to fit into the pelvis, babies are super smart.
Yeah.
They're really, really smart. So if they're in a posterior position, and it could have been that he was posterior because of a cord, maybe he was so wrapped that he couldn't come in any other way. There could have been some other type of anatomy issue. But a posterior baby, a lot of times they have, in order to fit into the pelvis well, they have to deflex their heads. Does that make sense?
Yeah.
So look what happens to when the baby goes in and has to deflex. Look what happens to the back of mom's spine.
Oh.
Yeah, so moms are feeling a lot of
That's what
intense
happened with my son. He.
Are you just like, oh my gosh, it's all making
I know,
sense?
my first, they explained to me that it's easier for babies to dive than to do the limbo.
Oh,
That's
I
what they
love
said,
that.
yeah.
I love how
So
they
it's
said
like,
that.
yeah.
So easier for babies to dive than to do the limbo.
Yeah.
Yeah. So, and we know that babies can come out in a posterior position, but for many women, it's a little bit more difficult. Not for all women, but for many women, it's a little bit more difficult. It can often lead to a more difficult labor, a more drawn out labor.
How can you tell if it's posterior or if they're just having a pause, if it's drawn out?
So yeah, I would look for all these signs. So yeah, if the mom's not having back pain, she's having a pretty straightforward labor pattern, she's it's moving forward in a pretty normal way, like less than 24 hours, and then she has a birth pause, she probably just needs to fall asleep. If she's still having really intense back contractions, but her dilation has paused, that's when we know it's probably a baby in a malposition. So babies can also, there's another malposition that we quite commonly see, and that's where babies are, like their heads are a little bit twisted.
That was my second.
Yes, you just had it all.
I just had them all.
You just had it all. Yeah, so where their heads can be a little crooked like this. So maybe they're in an anterior position, but their heads are just a little bit like this. So all of these things that I'm going to teach you and show you, they can help a baby rotate and straighten up. And if the baby's in a perfect position and you don't really know, you can still do these things, and it's not going, none of these positions will cause a baby to go asynclitic or rotate to a posterior position. Okay, so the best thing you can do, the number one best thing you can do if you have a baby in a posterior position is to move. And it can be exhausting. It can be exhausting to move so much. And so I usually have moms move a lot and then rest on their side over a peanut ball. The peanut ball is magical. Ivy and I are going to show you some of these positions right now. So we're going to show you a few things. The very first thing that you want to do if a woman is having if she's having intense back pain and you suspect that there's a posterior baby, is to try to kind of ease that baby out of the pelvis a little bit to give it some room to re-enter into the pelvis. So this is the pelvic brim right here, right? See how much room there is there? So much room. This mid pelvis, this is the tightest part of the pelvis. And a lot of times when a mom gets to 6 centimeters and that baby's like has descended into the pelvis in a posterior position, that means that that baby's in that mid pelvis, that hardest part, that skinniest part of the pelvis. And so to encourage a baby to rotate in order to come out in an anterior position, it's helpful to move that baby a little bit out of the pelvis up into the brim of the pelvis. So this is going to help kind of ease that baby out of that mid pelvis and out into the brim. So we're going to give that baby just a little bit more room to try to rotate. Now put your chest down on the ground and then go forward like you're going to fall over if I'm not holding you up. Is that on your, yes, there you go, perfect. Okay, so this is what's called an open knee chest position. You can call it the child pose with the bum stuck in the air. Okay, I'm going to hold back. Does that help?
Is your baby moving?
Okay, so what you can do, as we move your knees about shoulder width apart. There you go. Perfect.
I forgot I was supposed to be pregnant. Okay.
Yeah, you're supposed to be pregnant. So scooch forward just a little bit more with your chest. There you go. Oh, because did you see how that completely changed your bum? Did you guys see that? So now we've got the pelvis like this. Upside down, like this. Can you guys see this? Okay, so we're gonna try to kind of ease her baby out a little bit. So I'm gonna take the Rosa and I'm holding her up because this is a really hard position to hold yourself in. And we're just gonna kind of shake a little bit. Shake, 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 shake. Okay, so Alicia's gonna use this to help hold her up. So we're really, really pulling there. So can I punch your bum, Ivy? Yes?
Yeah.
Okay, so another thing you can do is just kind of like punching the bum like this. I know this seems really interesting, but this can really, really help. Yeah, and for a lot of moms, they're like, that actually feels really good because you're giving kind of some counterpressure massage to the area. So we're just kind of easing that baby out, and then Alicia, you shake a little bit, and then I'm gonna do a little more pounding on the bum, then Alicia's gonna shake. So Alicia, you keep shaking, and I'm gonna show everybody what's happening. So here's our posterior baby, and we're kind of like easing that baby out. Do you see how we're easing that baby out, easing that baby out? Okay, so now we've probably got that baby out a little bit and up into the brim, right? So now we're gonna help Ivy stand up. Okay, Ivy, go ahead and stand up. And let's do some movements with our legs to kind of help open that pelvis. So we're gonna have Ivy like do this kind of thing, and then maybe you're gonna bend your knee and kind of lunge back and forth. And remember, she's in labor. She's probably tired because she's been doing this for a long time, okay? But she's opening up her pelvis and helping her baby to kind of rotate. Another thing that you can do is, will you do hands and knees? And here, put your baby in your belly. We'll put your baby in posterior. So the back of the baby is the heaviest part of the baby, right? So we're gonna wrap this around. Just very gently shake the belly, very gently. And we're gonna try to help kind of rotate that baby. That heavy part of that baby is gonna be encouraged to move forward and rotate down into an anterior position. Look, your baby's rotating. So her baby's kind of rotating around down to the front.
Baby's borrow peanut.
How does this?
Woo, yes!
How does this kind of get baby to know to turn the other way?
Babies know how to come out. They know. They know. And the only reason that they wouldn't is if they can't. So if for some reason they need to come out that way to preserve their life because of a cord wrap or something like that, then they'll stay posterior. So some babies can't rotate. They're posterior for a reason. I always say that we should trust the babies. Because a lot of people are like, that darn baby, that stubborn baby, I can't believe your baby did that to you. Oh my gosh, your baby doesn't even know how to be born. And that is so horrible. It's such a horrible thing to say because babies are extremely intelligent beings. They know how to stay alive and they know how to be born. If they're in a posterior position, you've done everything you possibly could do, there's some reason.
Yeah, that's what happened for me with my son.
Your baby must have known that he needed to be that way to stay alive.
Yeah.
So that might help you.
Help me process.
Yeah, he's really smart. Right? He's a really smart kid. So the first thing we do after we realize there could be a posterior baby is to get the mom in a knee chest and kind of help that baby ease out of the pelvis a little bit. The next thing you do, after you've done that for 10 to 20 minutes, you really help ease that baby out. The next thing you do is you want to walk around. So you'll want to walk around for about 20 minutes or so. You could go up and down stairs. The mom can crawl, any kind of movement like that. Then you want the mom to rest. So you want to lay down on your side and we'll show the peanut ball.
Is this like similar to the Miles circuit?
Yeah, so the Miles circuit, okay, you guys know how every single thing in obstetrics is named after men?
A man, yes.
Miles is a doula, a woman. Yeah, so she created the Miles circuit, and you can look up the Miles circuit anywhere, and you can find that circuit. So this is almost the exact same thing.
Just like
well, all it is I just say movement of any kind. So in the Miles circuit, it might be climbing up the stairs sideways, or it might be, but any movement that the mom feels, and that the reason why I don't give you a hard and fast rule of what that should look like is because the mom usually knows what she needs. Yeah. But I do like helping her to ease that baby out of the pelvis. So the movement could be walking up and down the stairs. It could be lunging. It could be hands and knees with a lunge. It could be like marching in place. It could be sitting on a birth ball. It could be sitting on a birth stool. It can be sideline, any positioning that the mom feels good with. And then I like to give her a rest. So the circuit would be the knee chest, any kind of movement, and then resting. And then just keep doing it over and over and over until the mom finds some relief. She will have contractions while she's in that knee chest position, but a lot of times the knee chest position will feel good. So she'll manage the contraction well. Okay, so now we're gonna get Ivy on a peanut ball. There are many ways that you can use the peanut ball. So she can hold it with 2 feet, or she can, see how she just straightened her bottom leg? We'll practice this more tomorrow. Here, let's put it right. Okay, straighten this bottom leg. Okay, so there are so many ways to use a peanut ball, and I'm going to show you guys all of the ways. A lot of times people come to my training, they're like, I need to know everything. All you have to do is say like, let's use the peanut ball, and you put it near the mom and she'll adjust it exactly how she wants it. I put it there for Ivy and she automatically straightened her leg because that's what felt good to her. That's what her body was telling her it wants. So peanut ball is fantastic for encouraging rotation of a baby. And it's a great position to rest in. So the mom's rested, but her pelvis is nice and open. Okay, as your baby has rotated, and
it's on the right side.
Good job. Okay, it's gonna be born. Push it out. I'll catch her. Oh, yay! Do you want to move the peanut ball or do you want to birth it this way? Oh, there you go. Your baby! Yay! A short cord. Okay, so the other thing that you want to remember with a mom who has a posterior baby is you want to address the pain, because she's going to be, while you're doing all these things, she's going to still be feeling a lot of pain. So I would say the number one thing we do is counterpressure on the back. Here, Abs, you want to show that on me? Okay, so the mom would be on her hands and knees, and then that's the exact right spot. Good job, I'm so proud of you. So you would just push straight down on those sacral bones, right kind of where the SI joints are. You push straight down on those. And then you can also do the double hip squeeze. Sometimes that feels really good too, and it's really hard to do. Here, do a little bit more right there. And you do a little bit more right there. See, the moms will tell you guys, so you don't have to remember exactly where. When you're not pregnant, a lot of people don't like it, but a lot of people do like it.
I like the back. It feels like your back is, like when it was my son, it felt like he was like pushing on my spine. And then when my husband squeezed my hips, it felt like he took them off my spine. So it felt like he kind of pulled me down.
Yeah.
So like I felt like I could breathe again.
Well, and also the double hip squeeze does that.
Yeah.
So you see how it kind of opens up the pelvis.
Mm-hmm.
So then you have a lot more room.
Yeah.
So that's exactly what you just described.
Yeah. Felt really good.
Yeah. It feels really good. Moms will come like after birth and they have bruises on their backs because they were like, harder, do it harder. So counter pressure is probably our number one go-to, but also hot and cold packs are really, really helpful. The TENS unit is trans-electrocutaneous nerve stimulation. And it's just these little pads that you can put on the back, and it just sends little electrical impulses that can feel really, really good too. And then there's another thing that we can do as providers, as midwives and doctors can do this. You guys couldn't do it, but it's something that you could say, hey, have you ever heard of this? Could we try this for my client? And it's called the sterile water drops or the sterile water injections. So you take a little bit of sterile water in a syringe and you raise a bump under the mom's skin on her back, like a bee sting.
Does it like relieve pain?
So the thought is that it brings so many endorphins to the area that it will relieve pain. Yeah.
Do they do that
I've seen it a couple times in a hospital. Yeah, but the provider would have to know about it.
Yeah.
But you can tell them about it, and it's really easy to look it up. There's a million studies on it. If you had a client that was having severe back pain, you could say, hey Jane, is it okay if I make a suggestion to your provider? And then if you have a really open-minded provider, you could say, have you tried the sterile water injections? I've seen midwives do them, and I've seen a couple doctors really open to things like that. Yeah, so the sterile water injections, what are some of the other things that are helpful for the back pain? Yeah.
By causing
By causing pain, yep.
Really?
That it will relieve pain. Yeah, so sometimes back pain is so great that the thing that helps it is an epidural. So if the back pain is so great that the mom is suffering, if she's reached the point of suffering, then an epidural can be a really useful tool. And the epidural can sometimes release the pain so much that the mom's muscles and bones are able to also release. She's able to let go, and that allows for the rotation of the baby. So that's kind of our last resort, but sometimes it can be really useful. And put the mom on the peanut ball. If she has the epidural, put her on the peanut ball.
Only at the hospital?
Yes, at the hospital, yeah.
Can't do an epidural anymore.
No, not an epidural at home birth, nope. Yeah.
So you can put them on a peanut ball with
At
an epidural?
Yeah. The peanut ball is like your number one best friend tool with a mom who has an epidural. Yeah, it's wonderful.
Wow.
So you would just position her legs at that point if she already...
Yeah, so usually she's kind of turned to her side anyway because epidurals work on gravity, and so if she's on one side too much, this side will get really, really numb. And so a lot of times she's already being switched back and forth by the nurses. But if you're a doula helping someone with an epidural and you want to use the peanut ball, I would say 20 to 30 minutes, turn her every 20 to 30 minutes and put her on the other side with the peanut ball. Yeah, and another thing that you can do is like if the mom's on her side with the peanut ball, you can take her leg and bicycle it. So I'm just letting her. Yeah, good job. So you can bicycle her leg. So maybe she can't feel her leg, but this is a really good way to help. Yeah, any of that kind of movement, really good way. You guys, I promise the baby's gonna be like, oh my gosh, the pelvis, I can move now. That is the end or a posterior discussion. What questions do you guys have?
So you wouldn't approach any of this unless you're seeing the signs, like you said, like the back pain, the stalled labor.
So a lot of moms do that. A lot of doulas will do this with their clients, even if they're not feeling
Yeah.
any of this back pain, because it can be beneficial for any type of labor.
Gotcha.
Any movement is beneficial.
Okay.
Yeah. And you won't accidentally turn a baby to a posterior position.
I guess, sorry, I think because I experienced this, it's like more real for me.
Yeah, for sure.
Because we went through and did a ton of position changes. I was in the halls walking, I was on the birth ball, had the little, I had a bed sheet
Yeah,
and like the closet door was just swinging.
yeah.
And even with all of that, like my son still wasn't able to turn and get
Yeah,
in.
and he could have been so
Yeah.
cord wrapped that he wasn't able to.
Gotcha.
So yeah,
Yeah.
and that would be my guess with a first vaginal birth and a second C-section.
Yeah.
It would be my guess that they tried everything. That
They
you
really
tried
did.
everything.
Yeah.
And that your son was like, "I'm sorry, guys, I can't move. I'm just
Yeah.
trying to stay alive."
Right, and there
Yeah.
was a moment, because they did a cervix check and they found meconium, so I knew that he was stressed out and that
Yeah.
scared me. So when I talked to him, I was like, buddy, you gotta get in the right spot. And I
Yeah.
felt him for the next 45 minutes, like trying to jam his head like in the
Yeah,
right
he's
place.
trying really hard.
And he
Yeah.
couldn't, like, and I
Yeah.
think that's why I felt more at peace with like, all right, like we did everything.
Yeah.
before.
And that's when we are so grateful.
Yeah, for those
for-
interventions.
Yeah, interventions. Yeah. When they're used necessarily.
Right.
We're not thankful for them when they're used unnecessarily.
Yeah,
right?
exactly.
Yeah. Well, I'm so glad your son is here.
Thank you.
Yeah. Okay. Do you guys want to practice